this sort of takes off from the same idea in that, what do we know about, the impact of myelofibrosis mutations outside of the JAK-STAT pathway, right? And, I think as per what I've just talked about, there are impacts both prognostically, but potentially also phenotypically. And, we've known that there are several mutations that seem to be associated with disease progression in myelofibrosis. And I think that list is certainly growing. A number of groups, including ours, have recently defined new mutations that seem to have a prognostic relevance for myelofibrosis. So I think our understanding of the landscape of prognostic mutations is growing and changing. Now, what does that mean for the patient? I think that is really the key question that we need to now try to translate that knowledge into. Does that change how one approaches the patient? Does one move to transplant earlier? Do the impact of those mutations change the likelihood of how well a patient will respond to a transplant? I think those are key questions that come out of the genomics of myelofibrosis. But also, do people respond to the current treatments? I mean, there's data now that's several years old that seems to indicate that certain mutations, and in fact the number of mutations, might influence how long a patient responds to Ruxolitinib, right? So I think that in many ways, our the discussion of myelofibrosis that I'll give at SOHO is similar in that there is the understanding of mutations and their impact on the biology of the disease, but also the understanding of the impact of mutations on prognostication, both in terms of the natural history of the disease, but also response to treatment.